In recent headlines, the legendary Bruce Springsteen has postponed his tour due to an illness. That's right, folks. The boss himself has had to hit the pause button on his music tour, a decision influenced by medical advisors due to the onset of peptic ulcer disease. This news follows some previously missed shows, adding a somber note to the rhythm of his much-anticipated tour. Now, this isn't just a hiccup in the schedule. The tour that kicked off with a bang in February 2023, after being delayed due to the pandemic, will now have a 2-month hiatus. The stage will miss the energy of the E Street Band, and the fans, eagerly waiting for their rock icon, will have to wait a while longer. The next scheduled performance is set for November 3rd in Vancouver, but until then, the boss's guitar will be silent. The boss will be taking some time off to focus on his health, but what exactly is this illness he's dealing with? Peptic ulcer disease is a common digestive disorder affecting about 6 million Americans annually. But what exactly is it? Well, peptic ulcer disease is characterized by open sores that develop on the lining of your stomach or small intestine. These aren't your everyday scrapes or cuts, but painful lesions that can make eating a chore rather than a pleasure. Now, you might be wondering what causes these sores. Contrary to popular belief, stress or certain foods do not cause ulcers. The real culprit is the wearing away of the stomach's protective mucus layer. This layer is like a shield, protecting your stomach and intestines from the powerful acids that help digest your food. When this layer gets compromised, acid can eat away at the tissue, causing those painful sores we call ulcers. Symptoms of peptic ulcer disease can vary, but the most common one is a burning abdominal pain. This pain can be mild or severe, and it's often mistaken for heartburn. Other symptoms can include nausea, bloating, and even a change in appetite. Interestingly, these symptoms might not always be constant. They could come and go, and often get worse when your stomach is empty. What's important to remember is that peptic ulcer disease isn't a condition to be taken lightly. If left untreated, complications may arise, making it crucial to seek medical attention. So if you're experiencing persistent abdominal pain or other symptoms, don't brush it off as just a bad meal or stress. It might be something more serious. Like the famous musician Bruce Springsteen, anyone can be affected by peptic ulcer disease. It's not about how tough or resilient you are, it's about getting the right treatment and taking care of your health. While peptic ulcer disease sounds daunting, there are several treatment options available. The first line of defense often includes medications. Medications can help by reducing the acid in the stomach, allowing the ulcer to heal. In some cases, antibiotics may be prescribed to fight against the bacteria that can cause ulcers. For those who have severe cases of peptic ulcer disease, surgery might be necessary. This is generally considered a last resort when other treatments haven't worked or complications have arisen. However, it's important to remember that most people with peptic ulcer disease respond well to medications and don't require surgery. Now let's talk about prevention. While it's not always possible to prevent peptic ulcer disease, there are certain lifestyle changes that can reduce your risk. One of the most effective ways is to avoid smoking. Smoking can increase stomach acid and make you more susceptible to ulcers. Cutting back on alcohol can also be beneficial, as excessive drinking can damage your stomach lining. Another key aspect of prevention is being careful with medications. Certain over-the-counter and prescription drugs, including some pain relievers and anti-inflammatory drugs, can lead to ulcers. If you need to take these medications, it's best to do so under the guidance of a healthcare provider. Lastly, maintaining a healthy diet can be beneficial. While no specific food causes or prevents ulcers, a well-rounded diet can promote overall digestive health. With the right treatment and care, it typically takes 4 to 6 weeks for peptic ulcer disease to heal. So, as Bruce Springsteen takes a break to recover, he's not alone in his fight against peptic ulcer disease. Every year, about 6 million Americans face this condition, characterized by painful sores in the stomach or small intestine lining. Recognizing symptoms like abdominal pain, nausea, and discomfort after eating is crucial for early detection. Treatment options range from medication to, in severe cases, surgery. Lifestyle changes can also help in preventing this disease. As we wrap up, it's important to remember that health comes first, even for rock legends like Springsteen. We wish the boss a speedy recovery and look forward to his return to the stage.